Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Our topic for today is advancing prevention and care through the Hearts Initiative. Joining me on the program is Dr. Dianele Drepaul, the coordinator of the Chronic Disease Unit here at the Ministry of Health. Welcome to the program, Dr. Drepaul.
Thanks for having me on the show, Alicia.
Today we're talking about advancing prevention and care through the Hearts Initiative. And I know World Heart Day is approaching. Could you tell us about the theme for this year? Quite interesting. Use heart for every heart. Tell us what these themes mean to us here in Guyana.
So basically, the theme, what it speaks about is taking care of your heart and the heart of others.
Okay, and World Heart Day, what is the takeaway from this day? I know this is not only observed in Guyana, this is observed globally, but what it is that we want persons to take away from that day's observance?
So basically, what this day is about is trying to raise awareness about your heart health and those of others so that you could take preventative measures to prevent these diseases.
Especially cardiovascular diseases,
Yes.
right? Tell us the situation here with regards to cardiovascular diseases in Guyana.
So basically, cardiovascular diseases, they're on a rise. According to WHO, there's approximately 17 million persons who are affected with this disease. And in Guyana, this is one of the leading causes of death. It's among the 10 leading causes of death. So you'll find mostly ischemic heart disease, strokes, and hypertension accounts for the majority of the cases in Guyana.
I know here in Guyana, we would have adopted the Hearts technical package to help to curb some of what we experience here. Tell us what this package is and why it was adopted by the Ministry of Health.
Okay, well, basically, the Hearts technical package is a standardized treatment in the approach of managing cardiovascular risk factors and hypertension at a primary healthcare level. It also incorporates diabetes, which we call the Hearts D program. And as I said, we look at the risk factors for cardiovascular diseases or like hypercholesterolemia. We also look at those things.
So, Doc, tell us, how does the Hearts package improve hypertension and the treatment of other cardiovascular diseases here in Guyana?
So basically, HEARTS is an acronym, and it stands for H is Healthy Lifestyle Counseling, E, Evidence-Based Protocol, A, Access to Essential Medicines, R, Risk-Based Management for Cardiovascular Diseases, T, Team-Based Care, and S, Systems for Management. So HEARTS is basically standardized treatment, as I said before. You would find if you visit a health center within Georgetown, you'll find the same medication if you visit a health center, let's say in Region 9 or Region 10. And also we have equipment just like the BP apparatus, which is calibrated. That means that you will have accurate readings. We also introduced for Hearts D, the HbA1c machine, which we have at some of the health centers. Right now, it's not widely spread, but within the upcoming years, we foresee that all of our health centers will have these equipment along with point-of-care cholesterol machines.
Okay, is the Heart package, is it in all of the health facilities across Guyana?
So basically, we're at 244 health facilities, and we're hoping by next year we should reach all of our health facilities.
Okay, so our healthcare workers who are at those health facilities, they were already trained to manage and deal with this package.
Yes, so our department is in charge of training. Annually, we do a train of trainers, whereby we bring at least 2 or 3 champions from the regions. We train them, and in turn, these persons, they return to their facilities or within their sub-district, and they train their personnel within the region. Also, when we do supervisory visit, our team do in-house training. So they constantly have trainings.
Awesome. Let's talk a little bit about the early success of this package since the rollout.
Okay, so we actually rolled out in 2022 at 8 pilot facility, and as you can see, we have grown.
Indeed.
Yes. So we recently concluded a research in Region 2, and from that research, it has shown that the Hearts initiative has been making good grounds. Most of our patients now, they're controlled. The reason behind that is that our medication that we offer patients is just one tablet a day. So patients tend to be more compliant with their medication. And we did surveys among our patients and our doctors, and we found that it was well received.
Wonderful. For patients, how have they been responding to this new initiative?
Okay. At first, you would find that, when you introduce change, some persons were hesitant because they were
Yes.
accustomed to certain medication that was in the system. But after giving them the benefits of these new meds, and so persons, they agreed and they changed to these new medication, and they found that these new medication were
Works
better.
better.
Yeah. So I said it was well received.
All right, so we're going to take a short break and be right back with more on hearts.
Here's an invitation to the whole wide world. From your brother to your sister to your best friend's girl. Here's an invitation to the whole wide world. From your brother to your sister to your best friend's girl.
Exercise in your 40s seems trivial, but you need it now more than ever. The body starts to decline after 30, and that decline gets more aggressive every year. But exercise slows that decline, helping you prevent some common health conditions. To stay happy, healthy, and looking as great as you feel in your 40s, try these. To prevent heart disease, try cardiovascular workouts. It's a heart-pumping exercise that will keep your heart muscles strong. Ward off osteoporosis by adding a light jog into your walking workout to keep your bones strong. To fight arthritis, even in its tracks, strength training has been proven to decrease joint pains. Women between ages 45 and 64 have an increased risk of depression, and yoga reduces stress and regulates mood. Back pain becomes common as we get older, so try holding a basic plank for 90 seconds. Life's a little sweeter over 40. Eat well, keep moving. A message from the Chronic Disease Unit of the Ministry of Health. Exercise gives you more than just a great body. Some benefits you can't see, but you can feel. Cardio increases your heart rate and improves circulation. 60 minutes is good for heart health and 30 minutes for overall health. It helps boost your immune system, eases your mind, and rejuvenates your body. Now let's talk muscle. The more muscle mass you have, the more fat your body burns while resting. A pound of muscle burns 3 times more calories than a pound of fat. So, having more muscle means you can consume more calories. Exercise can improve the look of your skin, boosts your self-confidence, and helps you sleep better so you can wake up and do it all over again. 30 consecutive minutes per day, 5 days a week. Start now. Eat well, keep moving. A message from the Chronic Disease Unit of the Ministry of Health.
Welcome back to the program. For those of you who have just tuned in, today we're talking about advancing prevention and care through the Hearts Initiative. With me is Dr. Drepaul from the Chronic Disease Unit. Dr. Drepaul, let's talk a little bit about some of the risk factors for heart disease. We know we want to prevent that. Prevention is always better. Let's talk a little bit about that.
Okay, so risk factors, they're divided into two, modifiable and non-modifiable. The non-modifiable, those are risk factors we cannot change. Just like your sex, gender, some family history of certain diseases, we cannot change those. And the modifiable ones, those we could work with. So these are like your diet. We always strive to ask our patients to eat a balanced diet, which encompass fruits, vegetables. Us Guyanese, we like to eat a big bowl of rice, and so that shouldn't be. Within our department, we have a food plate where we depict how your plate should look like. So these are some things that you need to look at. Another risk factor you need to look at is inactivity. You know that we're advancing in the world now, so we don't tend to walk much like
True.
before. Everybody has a car. If you have to go to the corner, we jump in our car, and so. But we should really practice walking a lot.
Physical activity,
I'm not
indeed.
sending anybody to run marathons and so, because
But it can
all
be
of
the
us,
simple things you
yeah,
do. Maybe walk around your compound,
yeah.
walk from your house to the corners, the simple things. Walk up the stairs instead of taking the elevator.
Yes, things like that. So we urge persons to get at least 150 minutes of exercise per week. So you could get, when we talk about exercise, though, you have to get a heart pumping, not
Yes.
just walking at a slow pace, because that won't do anything. So those, another factor is salt intake. Most of our fast foods and these canned foods has a lot of salt in it. So we need to practice when we go to the
Reading
supermarkets,
the
you look
labels.
at your labels and see the amount of salt you have in those tins. Also, when we cook, decrease the amount of salt that we throw in our stews and so forth. We also need to look at stress, because stress is a major killer. So we have to look at ways in which we could decrease our stress, practicing yoga, meditation. Like, I have a meditation app on my phone. If I feel a little bit stressed, I turn it on. It has nice music. Try to block out everything. And sleep. Sleep is very important too. You have to try and get at least 8 hours of sleep so the body could recuperate. Those things will help decrease stress. What am I forgetting? What are the risk factors? Oh, our toxic habits. Yes. So we have seen that over the years, these hookah lounges, the vaping, these
Yeah.
things have become very popular, but it's very detrimental to our health. Also, drinking alcohol. Recently, I read a study that came out that said any level of alcohol now could increase your chances of getting cancers.
Wow.
So we need to eliminate all of those toxic habits from our lives.
Indeed. Thank you for sharing, Dr. Drepaul. What are some of the symptoms of heart disease for persons who may not be visiting their health centers on a regular or not doing those yearly checkups? What are some of the symptoms that persons might see that says, okay, this is the early sign of something blooming, something developing?
So it depends on what you're suffering from. If you're having a ischemic heart disease, or what we know as a blockage, some patients might find it difficult going up the step. You might have shortness of breath. You might have to walk 1 or 2 treaders, and then you have to stop, catch your breath, and then you go on. Some persons might find that they're having chest pains. The chest pain may be right here in this area. It might radiate to the arm. If it is that you're feeling that, you need to go and get checked out at your nearest health facility. If you suffer from hypertension, some patients, they come, they tell you, Doc, I have a terrible headache. It might be at the back of your neck, you're feeling this tension, you don't know why it is. Those are reasons why you should visit your health center and get checked out.
Dr. Drepaul, you mentioned visiting our health centers, and I know that this is something that persons usually do not do unless they are experiencing a severe health condition. Could you stress a little bit more on the importance of visiting your health centers, not only when you're sick, but to ensure that you are physically healthy?
Yes, so basically we have this attitude that, okay, only when I'm sick, I'm going to
Yes.
visit the doctor. But really and truly, annually, we should visit our doctor so we could have a complete medical. It's a wellness check, basically. That way you could detect something before it becomes a problem. Even our kids, we neglect to visit the hospital because we're saying, okay, nothing is wrong with them, they seem fine. But we need to practice that everyone needs to go to their nearest health facility and have a medical. And whilst on that point, I'd like to say that we have the universal healthcare voucher
Yes.
for the adults and children. So you could visit your health center, you collect one of these vouchers, and you could visit any of
The health facilities.
yes, our labs that we have partnered with, and you do the test, you go back to your health center and let your doctor read off the results.
Indeed, and I want persons to know that these health vouchers are free of cost. Just visit your nearest health center and ensure that you uplift those. I know, Doc, usually persons say things like, "What it didn't bother me, so I'm not going to bother it." But visiting your health center is very important. Visiting the doctor yearly or having your 6 months checkup regularly is very important so that you can know what's happening in your body so that you can maintain a healthy lifestyle. On
And to add something, Alicia, our department, we have developed a passport for males and females. So if it is that you don't know like what tests that you're supposed to do, we have been sharing out this passport. It will tell you by age range, like what labs you should have, what vaccines you should have. So do visit these centers. You could request these books. You could read and see what it is. Just in case your doctor forgets to give
yes.
you a test or two, you could say, "But look, in this book developed by the Ministry of Health, I'm of this age and I'm expected to do these tests."
Indeed. So for a heart test, to get a heart test done, you don't need to be experiencing any pains or anything. It's something that you can just go and get screened
So
for.
we don't routinely do like our ECGs or so. You have to have some type of
Some
indication.
okay.
That is not within our routine tests. When I speak about routine tests, we do like your CBC, which is a complete blood count, your renal function test, your liver function test, and so. But when we go specific now, like I mentioned earlier, if you're having like chest pains and so, then your doctor would indicate, okay, let me first send an electrocardiogram to see if
What's
there's any
happening?
changes or so. Yeah.
Thank you, Dr. Drepaul. But before we wrap up today's program, what word of advice do you have for our listening and viewing audience with regards to protecting their heart, caring for their heart, and ensuring that they put their health as priority or make health a priority?
So, as I mentioned before, risk factors, we urge patients to just eat a balanced diet, do some form of activity, reduce your salt intake. You get rid of your toxic habits. I know it's a little bit difficult, but if you want to live longer, you must abide by these laws. Because
Yes.
we found in Guyana that persons at early age now, they're experiencing some form of cardiovascular disease.
Wow.
So please visit your nearest health center and get checked out.
Thank you, Dr. Drepaul. And I encourage you and your department to keep up the good work that you guys have been doing at the Chronic Disease Unit.
Thank you for having me, Alicia.
What does a healthy plate look like? It's made up of whole grains, healthy protein, vegetables, and fruits. Let's start with whole grains. Eat a variety of whole grains like whole wheat bread, whole grain pasta, and brown rice. Avoid those refined grains like white rice and white bread. Healthy protein. Choose fish, poultry, beans, and nuts, limiting red meat, cheese, and avoiding processed meats like bacon. Fruits and vegetables. Eat a variety of fruits and more green and other colored vegetables daily. They provide a variety of nutrients, antioxidants, and fiber, which build the immune system, prevent obesity, and promote healthy, youthful skin. Use more organic seasonings and less salty products like aji cubes and packet or bottled seasonings when preparing meals. And lastly, stay hydrated. Drink at least 8 cups or pints of water daily. Tea and natural fruit juices are great options. Avoid sugary foods and sweetened beverages. Eat well, keep moving. A message from the Ministry of Health Chronic Disease Unit.
Mom, why am I fat?
One in 3 children in the Caribbean is overweight or obese. 41 million children under 5 years, 340 million children between the ages of 5 and 19 were overweight or obese in 2016. They are more likely to become obese adults, have an increased risk of early onset diabetes, heart disease, breast, and colon cancers. Obesity is preventable. Make healthier food choices and engage in regular physical activity to reduce childhood obesity. A message from the Ministry of Health Chronic Disease Unit.
What do you call it? Cold one, hard stuff, booze, liquid courage? The list is long, as is the list of its effects on the brain and body. We know the behavioral changes, we've seen it before. Slurred speech, changes in mood, unsteady walk, or even total loss of consciousness. It can cause other bodily damage too, like damage to your heart muscle, high blood pressure, stroke, liver damage, immune system suppression. It's also a known risk factor for cancer. Those are just to name a few. What about the people around you? Alcohol can influence domestic violence and cause road fatalities. Don't cause or become a statistic. Stop, think, don't drink. A message from the Ministry of Health Chronic Disease Unit.
Thank you for staying tuned with us. Remember to stay tuned to our Facebook page and our other social media platforms for your health updates. I'm Alicia Martin saying goodbye for now.